treatment. Hypertension is defined as the consistent elevation of systemic arterial blood pressure. There are 3 factors that contribute to blood pressure: blood volume, which is the amount of blood circulating throughout the body; peripheral resistance is the resistance of arteries to blood flow; and cardiac output, which is the amount of blood pumped per minute by the heart. Increases in each of these categories will increase blood pressure. Hypertension is a fairly common disease in the United States, occurring in 1 out of every 3 adults, or about 29% of Americans. African American males have the highest rate of hypertension. African Americans are also at higher risk for variations in blood pressure, as well as organ failure due to those variations. Approximately 54,000 Americans die each year from hypertension and is a contributing factor to 300,000 additional deaths per year. The classification of hypertension there are 3 classes of hypertension used for treatment purposes. Prehypertension, also known as borderline hypertension, is classified by a systolic pressure of 120 to 139 millimeters of mercury and a diastolic pressure of 80 to 89 millimeters of mercury. Stage 1 hypertension is classified as a systolic pressure of 140 to 159 millimeters of mercury and a diastolic pressure of 90 to 99 millimeters of mercury. Finally, stage 2 hypertension is classified as a systolic pressure of 160 millimeters of mercury or greater and a diastolic pressure of 100 millimeters of mercury or higher. As a nurse, it's important to understand that blood pressure fluctuations can be transient and can be due to other things such as stress, pain, or excitement. The diagnosis of hypertension is typically made only after the patient has had a systolic pressure greater than 140 millimeters of mercury and a diastolic pressure greater than 90 to 99 millimeters of mercury on multiple different clinic visits. Patients with hypertension are at greater risk for cardiovascular disease, aneurysm, and heart failure. Next, we'll talk about drug classes used for the treatment of hypertension. The first drug class are diuretics. Diuretics are drugs that increase the rate of urine flow. They are the first widely prescribed class of drugs for treatment of hypertension. The goal of most diuretic therapy is to reverse abnormal fluid retention by the body. Diuretics are still considered the first line of defense in treating hypertension because they have very few adverse effects. Many different types of diuretics are available for hypertension, and they all produce a similar outcome: the reduction of blood volume through the urinary excretion of water and electrolytes. The most common mechanism by which diuretics act is by blocking the sodium ion reabsorption in the nephron, thus sending more sodium to the urine. There are 4 types of diuretics: thiazide diuretics, loop diuretics, osmotic diuretics, and potassium-sparing diuretics. Thiazide diuretics act by blocking the sodium ion in the distal tubule of the kidney. They increase the excretion of potassium. Loop diuretics act on the ascending limb of the loop of Henle. They block the reabsorption of sodium, chloride, and water. They increase the excretion of potassium. Osmotic diuretics act on the proximal tubule along the loop of Henle. They create an osmotic force to reabsorb water into the nephron and excretes nearly all the electrolytes. Potassium-sparing diuretics act on the late distal tubule and collecting ducts to block the reabsorption of sodium. They also reduce the secretion of potassium, but do not increase the excretion of potassium. Renin-angiotensin aldosterone system is one of the primary homeostatic mechanisms controlling blood pressure and fluid balance in the body. ACE inhibitors decrease blood pressure and increase urine volume. Adverse effects of ACE inhibitors are usually minor, but include persistent cough and postural hypotension. Angioconverting enzyme, or ACE, inhibitors prevent angiotensin 1 from being converted to angiotensin 2. ACE inhibitors block the effect of angiotensin 1, decreasing blood pressure through lowering peripheral resistance and decreasing blood volume. ACE inhibitors are usually combined with a thiazide diuretic for management of hypertension. Nurses should watch for persistent cough and postural hypotension with the first few doses given. Angiotensin II is created when renin converts the liver protein angiotensinogen to angiotensin I. When angiotensin I passes through the lungs, it's converted to angiotensin II. Angiotensin II causes intense vasoconstriction of the arterioles, which raises blood pressure by increasing peripheral resistance. ACE inhibitors block the effects of angiotensin II by decreasing the blood pressure through two mechanisms, lowering peripheral resistance and decreasing the blood volume. The next class of drugs are calcium channel blockers, which exert beneficial effects on the heart and blood vessels by blocking the calcium ion channels. By blocking the calcium ion channels, it inhibits calcium from entering the cell, which will limit the muscular contraction. Depending on the dose, calcium channel blockers can help relax smooth muscle, which lowers peripheral resistance, thus decreasing the blood pressure. They vary in their potency and by the frequency and types of adverse effects produced. The next class of drugs are adrenergic antagonists. The blockade of adrenergic receptors results in a number of therapeutic effects of the heart and vessels. The first class of drugs in this category are beta-adrenergic blockers. Beta-adrenergic blockers are located in the heart. These types of drugs are considered first-line drugs for the pharmacotherapy of hypertension. By decreasing the heart rate and contractility, they reduce cardiac output and lower systemic blood pressure. Another antihypertensive effect caused by the blockade of beta-1 receptors, which inhibits the secretion of renin and the formation of angiotensin II. The next class is alpha-1 adrenergic blockers, which are located in the arterioles. They help lower blood pressure by directly by blocking the sympathetic receptors in the arterioles. This help causes the vessels to dilate. The adverse effects of include orthostatic hypotension, which is the most common. Alpha-2 adrenergic agonists are located in the brainstem. They decrease the outflow of the sympathetic nerve impulses from the central nervous system to the heart and the arterioles. The next class we will talk about are direct vasodilators. These cause direct vasodilation and relaxation of the arterial smooth muscles. This class of drug is not commonly used today because it has serious adverse effects. Those adverse effects include reflex tachycardia. Patients with coronary artery disease could experience an acute angina attack. Another serious adverse effect of direct vasodilators is sodium and water retention. Next, we'll talk about medications specifically used in the treatment of hypertension. The first class of drug we mentioned was diuretics. An example of a diuretic is furosemide. Furosemide is a commonly prescribed diuretic. It inhibits the reabsorption of sodium and chloride from the loop of Henle and the distal renal tubule, and it increases renal excretion of water, sodium, chloride, magnesium, potassium, and calcium. This drug has a half-life of 30 to 60 minutes, and it is minimally metabolized in the liver with some non-hepatic metabolism. Life-threatening symptoms include erythema multiforme, Stevens-Johnson syndrome, toxic epidermal necrolysis, aplastic anemia, and agranulocytosis. Drug interactions include methotrexate, which includes an increased risk for methotrexate toxicity. There's also an increased risk of salicylate toxicity. The concurrent use with cyclosporine may increase the risk of gouty arthritis. It could also decrease the effects when given at the same time as sucralfate, cholestyramine, or colestipol. The nursing considerations when giving furosemide include monitoring electrolytes, renal, and hepatic function, as well as serum glucose and uric acid levels, so laboratory data is important. It's also important to not confuse this drug with Lasix or Lovox because they are different. It's important that the patient stays adherent to its regimen and is instructed to take his dose as directed. It's important that the patient be educated on the signs of orthostatic hypotension and to move slowly if he's experiencing it. Patients should understand that furosemide controls but does not cure hypertension. The next class of drugs we mentioned were ACE inhibitors and angiotensin receptor blockers. An example of this is lisinopril. It's indicated for the treatment of hypertension as well as heart failure management. It is an ACE inhibitor which blocks the conversion of angiotensin 1 to the vasoconstrictor angiotensin 2. This prevents the degradation of bradykinin and other vasodilatory prostaglandins, thus increasing systemic vasodilation. This drug has a half-life of 12 hours, and lisinopril is 100% eliminated by the kidneys. Its drug interactions include NSAIDs and selective COX-2 inhibitors, which may blunt the antihypertensive effect and increase the risk of renal dysfunction. There's also an increased risk of lithium toxicity, as well as an increased risk of angioedema with temsirolimus, sirolimus, or everolimus. The nursing considerations for this include monitoring blood pressure and pulse, especially during the initial dose of this medication, monitoring laboratory values such as serum potassium and serum sodium. It may cause hyperkalemia as well. The nurse should encourage the patient to comply with additional interventions for hypertension, like improved diet and exercise, and the patient should have their blood pressure checked weekly. The next class of drugs are calcium channel blockers, and an example of this is nifedipine. Nifedipine is indicated in the treatment of hypertension, angina pectoris, and vasospastic angina. This drug works by inhibiting calcium transport into the myocardial and vascular smooth muscle cells, and it results in inhibition of excitation, contraction, coupling, and subsequent contractions. This drug has a half-life of 2 to 5 hours, and it's mostly metabolized in the liver. Common side effects include headache, peripheral edema, and flushing. Life-threatening side effects include Stevens-Johnson syndrome, and arrhythmias. There are several drug interactions to be aware of, including St. John's wort, which may decrease its effectiveness. Grapefruit may increase serum levels and effects. Rifampicin, rifabutin, phenobarbital, phenytoin, and carbamazepine may significantly decrease levels and effects. Concurrent use is contraindicated in this case. Additive hypotension may occur when used concurrently with fentanyl and other antihypertensive nitrates, acute ingestion of alcohol or quinidine. Antihypertensive effects may be decreased by concurrent use of NSAIDs. So when giving your patient this drug, you should again monitor for blood pressure and pulse, as well as an ECG periodically during prolonged therapy. You should monitor intake and output ratios and daily weight, and assess for signs of heart failure, rash, which severe could cause Stevens-Johnson syndrome. And you should also monitor lab values, including serum potassium, periodically. The nurse should educate the patient to take medication as directed and to not discontinue it, even if the patient is feeling well. The nurse should also educate the patient on how to monitor their blood pressure at home. The next class of drugs we mentioned were adrenergic antagonists, and an example of this is doxazosin, and this drug is indicated for the treatment of hypertension. Its therapeutic effects include lowering blood pressure. This is achieved by dilation of the arteries and veins while blocking the postsynaptic alpha-1 adrenergic receptor. The half-life of this drug is 22 hours and is extensively metabolized by the liver. Common side effects include dizziness, headache, first-dose orthostatic hypotension, arrhythmias, depression, drowsiness, arthritis, gout, decreased libido, and dyspnea. There is an increased risk of hypotension with sildenafil, tadalafil, vardenafil, and other antihypertensives, nitrates, or acute ingestion of alcohol. NSAIDs, sympathomedics, and estrogens may decrease the effects of this drug. Nursing considerations include monitoring intake and output ratios as well as daily weight and assessing for edema, especially at the beginning of the therapy. Assessing for first dose orthostatic hypotension and syncope. Monitoring blood pressure and pulse 2 to 6 hours after the first dose, which with each increase in dose and periodically during therapy. This may be administered concurrently with a diuretic or other antihypertensive, and administering the daily dose at bedtime is important. The next class we discussed were direct vasodilators, which again we said weren't commonly prescribed anymore, but an example of this drug is hydralazine. Hydralazine is indicated for treatment in moderate to severe hypertension with a diuretic. The common side effects include sodium retention, tachycardia, angina, arrhythmias, headache, edema, drug-induced lupus syndrome, rash, peripheral neuropathy, nausea, and hypotension. The drug has a half-life of 2 to 8 hours and is mostly metabolized by the GI mucosa and the liver. Drug interactions include beta blockers, which decreased tachycardia. Metoprolol and propranolol increased hydralazine levels and increased blood levels of metoprolol and propranolol. NSAIDs may decrease the effects of hypertensive drug therapy. The nursing considerations for this drug include monitoring blood pressure and pulse, monitoring laboratory values such as CBC, electrolytes, and an ANA titer. Diet and exercise are important to encourage your patient to make lifestyle changes. This drug may cause drowsiness, so it's important to warn your patient of that. Next, we'll be discussing medication compliance, which is incredibly important in all patients, especially patients with hypertension, due to the increased health risks such as cardiovascular disease, aneurysm, and heart failure. Many clients continue to have hypertension despite their treatment. This can be related to poor long-term adherence and a pill burden on the client because multiple medications are often needed to reach targeted blood pressure. One way to reduce the pill burden and increase compliance is the use of a single pill combination. One pill can contain 2 to 3 medications like nifedipine, which contains a beta blocker and a calcium channel blocker. We posted at the end of our discussion a list of resources, and one of the articles, Effective Medication Adherence on Blood Pressure Control and Risk Factors for Antihypertensive Medication Adherence, has many important and good points about medication compliance for patients with hypertension. The rate of patients that adhere to drug regimens in the real world ranges from 20 to 80%. Medical costs are a large factor of why medication compliance is inadequate. Patients with support and guidance are more likely to adhere to medication compliance. Our goal as a nurse is to educate our patients as best we can to increase medication compliance. Next, we'll be talking about medication education for hypertensive drugs. So for furosemide, this drug is used to treat edema due to heart failure and reduces the symptoms of hypertension as well. It's important to work with the patient about compliance, which is taking furosemide as directed. If it is not taken correctly, this could affect the therapeutic effect of the drug. Missed doses should be taken as soon as possible. However, they should not be doubled, as this could increase the risk for having serious side effects. The patient should always understand that they need to change positions slowly to prevent orthostatic hypotension. It's important because some of the adverse effects include dizziness and vertigo. Thus, if the patient moves too quickly, it could put them at a great risk for fall. The patient should be notified that if they seem to be gaining more than 3 pounds a day, they need to call their healthcare provider, as this could be a sign of a serious adverse effect. They should also contact their doctor if they are planning to start any new over-the-counter medications, vitamins, or herbal supplements in order to avoid a negative drug-drug interaction. Serious adverse reactions the patient should be aware of are the fact that they experience any rash, muscle weakness, cramps, nausea, dizziness, numbness, or tingling of the extremities, and that they need to call their healthcare provider immediately because of the fact that these symptoms could be a sign of toxicity. This drug also causes photosensitivity, and the patient should be instructed on proper sun wear and protection. Non-pharmacological treatments in education include weight loss, exercise, stress reduction, moderation of alcohol consumption, and quitting smoking. Although furosemide may help reduce the symptoms of their hypertension, it will not cure it. It's very important to stress to your patient to always continue the regimen. Even if the patient feels better, they must continue their medication. Keeping a strict and regular medication regimen is essential to avoiding hypertension symptoms and adverse effects. Here is a list of references used throughout the PowerPoint, and we encourage you to take a look at some of the articles we found as they are new and up to date. Please email us with any questions you may have. Thank you for listening.